So, welcome to HDC Chat Speaking Series. And today we have the honor and the pleasure of having our special guest speaker, Mr. Lameen Abdul-Malik. Thank you for joining us today.
It's my pleasure, Rashida.
That's wonderful. So before we get started, I am going to read a short bio of our special guest speaker. Lameen Abdul-Malik is a Nobel Peace Prize laureate with over 20 years leading global initiatives in healthcare, nuclear science, and international development. This includes UK government, United Nations in Nuclear Science and Technology, the Future Investment Initiative Institute, and an international think tank, and as well as his own boutique consultancy in Dubai. He has spearheaded transformative healthcare, including Zambia's first cancer hospital and a global infectious disease index. An expert at the intersection of healthcare, innovation, and international development, Lameen Abdul-Malik brings deep insights into capacity building, sustainable healthcare solutions, and advancing global health equity. Again, once more time, thank you again for joining us today at the HDC Chat Series.
It's my pleasure, Rashida, and thanks a lot for inviting me.
We're going to start with the obvious but amazing award prize that you received. You are a Nobel Peace Prize laureate. That's not something most of us hear or meet every day. I had the honor of being introduced to you during my Fulbright scholarship with the amazing Karen Wakoli from Emerging Leader Foundation, without whom I would not have met you in person. I would have seen you just as a wonderful keynote speaker, way from in the back listening to you. So what's the story? Yeah, I do remember how we met with Karen. So
Yes.
that was just amazing, and that was pure luck, but also thanks to my Fulbright for making me at the right place and the right time to meet with you.
Of course.
So back to this great honor of being a Nobel Peace Prize laureate. Can you tell us the story behind this? And I think everybody listening wants to know more about this.
Yeah. So, in summary, so in 2005, my colleagues and I at the International Atomic Energy Agency were awarded the Nobel Peace Prize. The official reason obviously was to do with the promotion of nuclear science and technology for peace and development in the world. And let me try and break that down a little bit. So some people that
Please.
might be a little bit familiar with what the IAEA does, it's always been given this nickname of the nuclear watchdog. So back in 2004, 2005, some of my colleagues were asked to go and do inspections in Iraq to find out if there are any weapons of mass destruction. They didn't find any. But also what some people don't really know on the other side is that nuclear science and technology can be used for promoting peace and development. And that's the side that I worked on. For example, you can use the technology for fighting cancer, fighting obesity, developing new crops, addressing groundwater resources, for example. You can use it in industry, for example, for checking equipment or car accidents. And of course, most people know you can also use it for energy naturally. So one of the things it was awarded for us was using that technology to promote peace and development. So using a highly advanced technology to help developing countries advance and reach their development goals as well. I have to also share with you that I was also kind of lucky because we were actually awarded a $1 million prize for that, for the award, and $200,000 of that, so 20%, was actually given to my project, which was to establish the first cancer hospital in Zambia, which opened eventually in 2007. So that's a summary of basically the reason why we were given the award for also using nuclear science and technology to promote peace and development in the world.
This is amazing. this is more than I read and know about actually the background of the nuclear science and technology for peace. So thank you about that. I'm going to jump to you mentioned that 20% of the prize of the Nobel Prize, you dedicated that to establishing the first cancer hospital in Zambia.
That's
And
right.
this
Yeah.
hospital treats over 1,500 patients a year. What
Yeah.
does this project say about what's possible when innovation, when one of the highest awards meet local needs,
Yeah.
local healthcare needs?
Yeah. So that's a very good question. So so basically what used to happen what happens at the International Atomic Energy Agency, the IAEA, is basically the concept of promoting nuclear science and technologies is based on three main pillars. The first pillar is that it has to address a real need in the country. The second one is that the technology has to be not just viable, but it also has to be the cheapest way of addressing a particular problem. And it also has to be quite fast. So the idea is you need to link a development problem to the technology as well. So with Zambia, so before the first cancer hospital, there was already an incidence of cancer in the country. But because the country did not have a cancer treatment center, basically, if you had cancer, it was a death sentence in Zambia. So that was basically it. You get cancer, you're gonna die, unless of course you're quite wealthy to go abroad and get treatment. So obviously, it was a very dire need back then. I think the population in Zambia was about 13 million. I think it's gone up now to about 18, 19 million. And we already have like a way of calculating the incidence of cancer based on a million of people. I can't remember the exact figure now. So basically, there was definitely a few thousand people getting cancer in Zambia. So the idea was to say, this is a real need. People are dying from cancer in Zambia. How is it that we can now use a technology that is even though it's an advanced technology, to help mitigate that? There are different things, as you know, you're also from the health field. There are different methodologies for obviously treating cancer. There's things to do with pathology, there's chemotherapy, surgical oncology, for example. At the IEA, we're focusing on radiation oncology. So basically, there are types of cancers that get to a certain stage where you definitely have to intervene with the radiation medicine. And the idea was that some of these, so basically, the idea was to merge the technology with the real need. So when that need was actually addressed and developed, then we said, okay, you guys need to establish a cancer center. But what the IA does, it doesn't have that kind of money. So we actually helped Zambia develop the product document, which they took to a lot of donors and then got some money. For example, the OPEC Fund for International Development in Vienna, they gave them about $5.6 million. And Zambia also matched that. And then the product that I was managing, which came to almost $1 million, was used primarily for expert services and also to train some of the key staff in radiation medicine, like oncologists, medical physicists, radiotherapy technicians. And then we help them with some civil works engineering, for example, in terms of experts. So the idea is, by the time they opened in 2007, they were basically ready almost from day one. That if anyone said that they have cancer at a particular stage and they were scanned, that hospital can now start basically treating cancer patients, so that the hope was given to that population that if you get cancer, there is a possibility of you being treated within the country, no matter how rich or poor you are, because back then there was provision of treatment for anybody, regardless of their financial status.
What a beautiful and amazing story, and that is creating hope at the intersection of healthcare and technology to create
Yeah.
such possibility
Mhm.
within much needed environment.
Yeah.
So thank you for sharing that with me and the world. My I'm gonna move to another question, which is about your status, and you have led at the highest levels of diplomacy in nuclear science, from the UK government to the United Nations in nuclear science and technology.
Yeah.
How has this experience shaped your perspective on deploying emerging technologies like AI in global health and sustainability beyond what you just shared about the initiative of the cancer hospital in Zambia?
Yeah. I think that's a very good question. So maybe just to break down your question a little bit, I think looking at the concept of global health and AI, so I want to take those two things separately, primarily because obviously when I was working in the UK government and the IAA, the concept of AI was still like, science fiction, right? But I think, I always like to see AI as a tool. It's just a tool. For example, there was a point of time where if you were studying maths, you were not allowed to use a calculator. Then it said, okay, you can use a calculator now. So I like to see AI as a tool. I always talk about AI should be assisted intelligence or augmented intelligence, not necessarily something that's artificial. So I think that, when you're trying to address problems, so one of the things we did when I was working in the UK government was to help developing countries understand very complex trade agreements. And I think that if we fast forward to now, AI can assist in terms of looking at those agreements, breaking them down into a simple language, and then giving, negotiators what are the key points, for example, rather than spending literally months going through very complex trade agreements. And of course, the countries who have a lot of wealth at their disposal are able to go through these agreements much faster because, of course, they can contract out lawyers and stuff like that, whereas developing countries do not have that kind of luxury. What we did at the UK government was to provide capacity building training. So, for example, we were at the intersection of training developing countries at the cost of the UK taxpayer, I have to add that, to understand complex trade agreements so that when they came to the table at WTO, for example, they could understand, okay, what does this agreement have? How will this affect my economy? If I agree to lower, I don't know, taxes, import duties on textile, how is that going to affect, my local industry, for example? So I think that's one of the things I think that could be implemented. When it comes to nuclear science and technology, I'm aware that now my ex-colleagues are also looking at that concept of AI and also nuclear science and technology. Again, there's a lot of very complicated agreements that go on at the IEA in terms of things to do with countries subscribing to international agreements in terms of safety regulation. So that could also help them. Again, at the IEA, what we're doing is basically providing capacity building as well, to understand what is needed, what is to do with understanding safety requirements to protect the people. So that could be really, really important. So I think in summary, just to go back to your question, I think in terms of AI, that could be leveraged to make things a little bit simpler. In healthcare, particularly in this area that I'm very, very fond of, as you know, the projects that I was really excited about working in healthcare at the IAEA were the health ones because you could almost see a direct impact. So, for example, if I contrast that with agriculture, so we know it takes roughly now 6 to 8 years to develop a crop that's basically drought tolerant, that's more nutritious, for example, higher yielding. But then, it's very difficult to measure the direct impact on the population in terms of food. Whereas with a health project, like, I give you the example of the Zambia Cancer Hospital. So that project started in 2002, finished in 2007. But when it finished and opened, it means the next day you can actually start treating patients. You can see the direct impact almost immediately. Maybe there was a mother that had some kind of, I don't know, stage 1 breast cancer, but if she has that treatment, then you can see that she has hope of being there for her kids. Whereas with food, it takes a longer time to assess the impact. Whereas with health projects, when we were doing stuff on obesity or looking at fortifying local foods with iron and vitamin C, you could see almost a direct impact. So that's why I was very, 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 I have a strong bias for health projects, especially using leverage technology.
And here I can sense a lot of passion when you talk about innovation and the direct impact on these initiatives, especially in healthcare, because that's my area of expertise. And you're providing me with plenty of examples, which I'm grateful for. A follow-up question, which talks about this capacity building that you mentioned. What do you see as the key ingredients that is for building these international frameworks that keep pace with innovation? You mentioned AI as a tool, which is true. and it should
Yeah.
be called assistant intelligence, which is actually its role right now. May change in the very short term. But what is the key ingredient to keep pace with innovation globally with these capacity building and building international frameworks?
Yeah. I think I was having a discussion with one of my friends yesterday who's over from England. We're talking about AI and the impact it's going to create on the economy. I think one of the things people have always asked me often, what scares you most about AI? And I always talk about the concept of inequality, because as you know, to run data centers, to employ machine learning, you need a lot of energy. And we know that a lot of African countries, and strangely enough, just yesterday, there was a complete power outage in Spain and Portugal. So you can imagine for a lot of African countries, that's something that happens on a daily basis. You can't run, you can't even access you can't even access the internet without any energy. So I think in terms of frameworks, I think one of the things, and I know it might sound very idealistic, is to have some kind of international framework where it's promoting the concept of we're all in this together as humanity and we should all move in the same direction. And that's why some of the things that was very attracted in working in UK government. I worked in this international development in the UK government and also the IA, mainly looking at helping African countries, was the concept of capacity building, understanding that not everybody has the same level, and what can we do to help everybody reach some kind of at least minimum viable level where they can also survive. Ideally, we want to help people where they can also thrive as well. So I think in terms of international frameworks, there's a lot of discussion now about AI ethics. And next week, I'm going to be going to another conference in Abu Dhabi talking about AI governance. And I think the concept of making sure that it's fair access to everybody, that countries that might be struggling, developing some kind of technologies where there's a framework to help everybody move in the right direction. That is something that would clearly advocate, people to be sincere about helping the world as one and saying, okay, we know this technology is going to change everybody, but how can we help it? And everybody's at different levels. Don't get me wrong. What the US or Japan or China are going to use for AI, it's not the same as what Africa needs. And I always say that, look at the main problems in Africa, what's to do with food security, food wastage, for example, difficulty in diagnosing infectious diseases. How can we use AI to learn things very, very quickly? And it was something I was trying to do, when I worked at the think tank in Saudi, and I launched this Global Infectious Disease Index. And that index basically is to inform every government in the world, it's for 200 countries, about the most prevailing infectious diseases present in their country. And we worked with an AI company actually in San Francisco, which were run by epidemiologists, basically. So they basically found a way how to use AI to track diseases in every country. And the idea behind launching that index is to say, okay, at least if I can provide data to all ministers of health across the world that these are the diseases that are prevalent in your country, and try and find a way to tackle that. I'm not sure if that index is still running, because it's one of those things you have to completely pay for. But that was the idea behind that index, to just inform countries about what are the most prevalent diseases. And it was a bit of an eye opener. Like, if you take something like Denmark, I was shocked to learn that in the top 10 they had pneumonia is one of the top killer infectious diseases even in Denmark. So obviously with the winters, if you don't cover yourself, cover your chest properly, you're open to infection. And just things like that, protecting people, giving them information. So maybe I slightly digressed a little bit, but just going back to the concepts of equality for everybody and giving everybody equal access and addressing people at what their different needs are. Africa does not need an AI robot to help them clean the roads, or I don't know, build a car. That's not relevant. It might be relevant for China or for the US, but Africa needs basically like diagnosing TB very, very quickly. I did a paper on TB when I worked at the think tank. Like, if you can bring down the diagnosing rate from 1 week to a couple of minutes. And I actually met a UK company. There was a conference in Dubai. It's now called World Health Expo for Health. A UK company has found a way to diagnose TB within, I think, a couple of 2 to 3 minutes, which is fantastic using AI. So, and they're trying to raise funding, but I think if they could get a lot of funding, that would be fantastic, because before COVID, TB was actually the most infectious disease. It kills one person every 4 minutes, or no, one person every minute, one person every 4 seconds. There's about 1 million people a year die from TB. So if it can bring that, and because they get contaminated from it, and they spread it. Whereas if it can bring that, that incidence quicker, and we can diagnose it faster, that would be fantastic.
You said something really interesting that caught my attention. What scares you the most about AI? And you said equity ethics. In talking to you a couple of weeks ago, you were attending or you attended a conference in Abu Dhabi where you shared concepts about AI ethics with
Yes,
respect to the future of education.
that's
What
right.
were these aspects
Yeah.
that I didn't have the luxury of others to attend, but I did watch some of it. I
Yeah.
watched on LinkedIn and other posts, but if you don't mind sharing those aspects with the rest of us.
Yeah, sure. So, I mean, it goes back to the concept of how human beings actually learn. So, one of the things is that there's three things: we learn, um, we acquire knowledge, and then we practice. So, that's basically the theory of knowledge. So, I said that, you know, based on that, and looking at how human beings are, so we're very social beings. Um, any new technology should support us in how we learn, and it should not contradict how we learn, for example. And in fact, in 2023, there was a US report on education and AI said that any AI or machine learning tool that contradicts the theory of learning should be rejected. So, based on that, I did a bit of research into another technology that was introduced many years ago when robots came in. And it was a guy called, I think, Isaac Asimov. And so I tried to merge that into AI. So I came up basically with three things for AI ethics and education. So the first law is basically that AI should support how a student learns, number one. The second law is that AI should obey the instructions of the teacher, providing it does not harm a student's learning capability. Then the third one is that AI should be functional, provided it does not go against the teacher's instruction and the student's way of learning. So basically, those are the three things I came up with in terms of ethics. And I thought this was important just to share because, sometimes people say, oh, yeah, I want an AI policy. It could be that AI might not be the right tool. And I always go to this concept of if you a hammer is a useful tool, but if you use a hammer to put a light bulb in, you're going to break the light bulb. Right? It's not going to work out. So, so ideally, AI should be. That's why I always call it AI assisted intelligence. It should assist us in learning. Like sometimes quote, like when I was growing up in Nigeria, I went to secondary school and we had a class of about 35 people in the class. And so what would happen is that the teacher tended to focus a lot more on the smarter kids and other kids that were not catching up, which is basically almost 75% of the class. So I thought if we had AI as a tool, maybe in a classroom, the kids who are very fast, we could give them some kind of AI examples to work on complicated algebra, and the rest of the kids can learn through a human being like a teacher that can understand and interact and pull up things that AI cannot pull up, in terms of that human interaction and say, okay, I see you're struggling with this. You're blinking. Does that mean you don't understand that? How can I help you understand? I don't know, 1x plus 2x equals, I don't know, 3x, for example, right? So that was kind of based along those lines that I was thinking about the concept of AI ethics.
It is amazing, and you refer to it as AI assisted intelligence, which is exactly what a colleague or a special doctor nephrologist that I met during my Fulbright in Morocco calls it as well. And we ended up
Yeah.
publishing a paper in his area of expertise, leveraging my expertise in AI, and it was fantastic how seeing how AI is applied to support patient, but in an assistive and augmenting the
Mm.
doctors that are providing support and help to the patient.
Yeah,
Oh,
that's great.
yeah. Thank you for
I'm happy
reinforcing
we're
that also.
aligned.
Yes, yes. And you know that from our conversation, but you add a little bit more to the AI ethics, which I'm going to embed in my research and definitely my teaching graduate students in our applied AI here at my university.
Please,
Uh,
please feel free, and I'm sure you will probably report back to me on how effective it is. Maybe do another research
Absolutely.
on the importance of this AI ethics.
Well, you just said knowledge is about acquiring and practicing, but also about sharing and reporting
Yeah,
back. So it's that loop that makes us move forward
yeah,
into our knowledge and increasing our capacity of better knowledge being around.
yes. Great.
The Going always back to AI and because that's the area that I know the most about compared to all what you do.
Mhm.
With AI accelerating so fast, you shared several principles from our conversation so far, but what
Yeah,
are some of the key principles that today's leaders should focus on or should want to use these tools responsibly in
mhm.
healthcare and beyond? We talked about it a little bit in education and those
Yeah,
ethics, but now in healthcare and how the leader should use those tools responsibility when taking care of executives' decisions about healthcare or taking care of patients.
okay. Yeah, so good question. So perhaps I will start off with the origin of the word leader, right? So the origin of the word leader and leadership actually is from two languages, Arabic and actually English. So leader is related to a word in Arabic that leads to rope. So it's sort of like a rope. So basically, you usually use a rope to tie into something to pull it in a direction. And the aspect of leadership, ship comes actually from ship in English, right? So basically, you get onto a boat because you're trying to go somewhere, and you don't go onto a boat if you're not going if you're going somewhere that's going to be bring benefit. So in terms of a description of leadership, you're looking at a leader is looking at how they can the people that they're in charge of, how they can take people into a positive direction. And before I go on to the heart of the question, is I also like to quote what the Prophet Muhammad said, and he said that a leader is the servant of the people. So the concept is that even if you look at the concept of the civil servant, the highest civil servant in the country is actually the head of state. They're the civil servant, they're the servant of the people. So after that, going into concept of any area, whether it's even healthcare or AI, it's like, okay, if you're going to employ a particular tool, whether it's AI or something else, the people are obviously at the center of that decision. So what is it that the people really need? And what is the best and most effective tool to do it? If, for example, you say, yes, AI is the best tool, I like the way it's going, whether it's machine learning and other things, Gen AI, for example, is there something that we can invest more to make things a bit faster, to promote, for example, a healthier population, help people to have access to their own data so they don't know what's going on with them, whether they can have Gen AI to prompt, or do you have a headache? Is it on the left side of the brain, the right side of the brain, or the front side of the brain? Maybe you need Tylenol, maybe you need Panadol, maybe you need something else. I've heard this, I've had some conversations with some people in the health space in terms of that. So I'm just basically sharing some of the things they shared with me. And then you say, okay, how can we augment it? How can we fast track this? How can we put more money into this? Because I also want to understand how I can be a better leader and better servant to my people, for example. So, one of the things that when I was working at the Future Investment Initiative, at the think tank in Saudi, is I actually chaired a session on the future technologies in healthcare, and especially with a focus on how to mitigate the next pandemic, because sadly to say, there will be another pandemic, whether it's in the next 10 or 15 years. All the data points in that, whether you leverage AI data. But if we know that's going to happen, what can we start doing now So one of the things is to look at people's data, whether it's physiology data. We now know that, for example, during COVID, some people responded very well to a particular injection, but did not respond to another injection. So if we know that and we can get that data, what can we do? Also, what other data can we have in place that AI can help us to understand better what medicines will be more effective, for example? So we need to fast track investment in that particular area. And sometimes it saddens me, like I went to a conference last year in Rwanda. It was a health conference for not just focused, it was focused on Africa and healthcare. But at the conference, one of the speakers said, isn't it bizarre that there was just a conference on it wasn't the COP29 was just before the conference, and they're talking about people are upset that they're only allocating, I don't know what it was, like $300 billion for climate change. And they said if healthcare got a fraction of that, right, the problems will be solved. And what I also learned from the Center for Epidemiology, there's a center, I can't remember, they're based in Northern Europe, CEPI, that apparently now know there's only 20 types of, I think, diseases or something like that. They've done research for two. So basically, there's another pandemic. It can only come from these 20 things. And they only need, it sounds like a lot of money, they only need $3 billion to develop vaccines for every possible pandemic that a human being can get. But it's still short. They've only got 1 billion. I'm thinking that extra 2 billion can solve the problem, because look at what the pandemic did. It cost the world $5 trillion, right? So if we can allocate more resources to fast tracking technology that can help address these key things, I think that would help a lot. Babe.
It's mind-boggling, and yeah, the 5 trillion, and then we can't find 3 billion to prevent, or at least to alleviate a lot of the upcoming uh, pandemic. I don't know what to ask you. I really, what direction should we go? What is the question that I don't know that I should be asking?
Maybe I should ask you a question.
No. Uh, yes. If you're willing to contribute to that, please. Otherwise, I'm going to move to the next question, because you're, even though I am asking you, you're making my mind work so hard and so much that probably we'll leave it to our audience to have something to think about and contribute to this conversation. So to
Yeah,
all of you
yeah.
out there,
Yes, please. If anybody has anything that they're working on, they know of any technology that could be advanced, at least let's try and make it a bit more prominent, and let's see how we can hopefully get money directed towards that initiative that can have a big impact on humanity.
absolutely. That's the key word, impact on humanity. You mentioned something that resonated with me and with all of us. Better leaders are better servants, right?
Mm.
The better they serve their people, the more or the constituent, the we all move toward positivity and more impact. And you mentioned the leadership and the ship itself that is sailing. This is gonna take me to something that is dear to you, that you built recently, or an initiative that you started initially, or I'm sorry, recently, and it's about your company, Honest Management.
Yes.
I've heard quite a few things about it. Do you mind sharing uh, with all of us, how does it relate to your beliefs
Mhm.
around leadership?
Yeah, good question. So often people ask me, why do you call your company Honest Managers? Because you think that you're honest. And I said, no, that's not the reason.
Is
I
it
think honesty is something that everybody should aspire to. And
correct?
I'm not the kind of person that's going to say I have a halo over my head and I'm honest. So it basically comes out from.
You do, you just don't
Okay.
realize it, but you do. From this
Thank you.
side, you do.
Thank you. So it came to one of my beliefs around honest and honest management I really believe that everybody is a leader. Why do I say that? So I believe that only you can sincerely and honestly lead your life in the best way. So the concept of honest management means if you really want to thrive in this world, you honestly have to lead yourself and manage your life in the way that you believe is best fit. Some people think, oh yeah, leaders are superhuman. I'm not saying you're going to lead an organization with 5,000 people or lead a country, but at least you can start with leadership with yourself or within your environment or within your home, for example, or within your school or your university. And I think once you come to that realization, then you say, okay, yeah, I can be a leader of where I want to be where I want to go. If not, you will be misled by something else, right? So there's a author that I read, and he said that there's no such thing as a bad leader. They're only misleaders. so
I'm
so
gonna
everybody's
quote you
leading.
on that.
So everybody's leading something, but you're just do you want to be misled in some kind of direction? And we heard this a lot of times, like people either they're talking about they don't like their job, they don't like their relationship because they were forced into a situation that they did not really want to go into. But that was because they were misled into believing something that maybe I really believe deep down they did not actually have the time to think about it. And deep down, even the intuition was kind of dubbed down. So and I thought, okay, if I have a company, just call it honest management, because if I'm working with any clients, obviously I want to make sure that the first thing is to ask them what do they really want. It's not about what can I really give you. It's about what did you really want, and is that something that if that's what you really want, are you sure that's what you really want, and how can you work together to provide that together for you? Because it's not basically me leading you in that direction. I'm just supporting where you want to go, for example, in that direction. So that's one of the concepts behind honest management.
It is one of those people that care, or organization like yours that care about growth, whether it's personal, whether within a work environment. You ask those hard questions. What is it that you want?
Mm.
And that's really hard questions. As you said it, I'm stuttering because I'm thinking, what is it really that I want? And probably everybody listening to that, and you putting it in the right context to facilitate within honest management, and correct me if I'm wrong, to facilitate the direction of this particular leader wants to go and what they want to achieve. Is that correct?
Yes, exactly. Yeah. I think you've put it nicer than I did. So yeah, facilitate. I also like the word empower.
I like that
To
better.
yeah, to empower people because it's like it's not me leading you. I'm just empowering you to be more conscious of yourself about what you really want, and also that you be comfortable with, not something that you think that society wants or someone else wants. Because deep down, you know really what you want. I really believe if you give yourself that time and that space to reflect on what you want to achieve in life.
I love the term empower and the time and space I was afforded. I always go back to my experience as a Fulbright scholar in Morocco. It
Yeah.
afforded me the space, the time, and the location to pursue what I really wanted, which is further scholarship research at the intersection of healthcare and AI. What I ended up with, not only the theoretical part, but practical aspects as well. And sharing the top is meeting special people like yourselves, like Karen Macaulay, ministers, key leaders around the world. That's something really priceless when you are empowered and you empower yourself to
Yeah.
go after what you want. So thank you for reviving that experience and that feeling and that power to uh, allow me to revisit 22, 23, and hopefully it's still within me to keep pushing towards better things and better me.
Yeah.
Thank you for that.
My pleasure. My pleasure.
Pushing on that positivity and creativity and empowerment, if you had to spotlight one bold idea you're exploring now, something that truly could shift the global conversation, what would it be beside what you already shared?
Um, so one of the things that I talk a little bit often about it is the concept of a billionaire, and a billionaire is someone that wants to impact 1 billion people's lives in a positive manner. So moving away from the concept of billion as purely money, but looking at people instead. And I did try to dab in this a little bit when I did something called 100 Ideas Cafe. It was basically like a global platform to source ideas to impact 1 billion people's lives. I managed to get 22 startups, and then 10 went to a pitch day, 8 from the US, actually, 1 from Dubai, 1 from Thailand, but most of the companies are actually from the US. Um, 2 companies are actually actively getting funding. One is looking at the biodiversity space, and another one is was started by 2 retina surgeons, where from an eye scan, you can tell if someone has cancer or diabetes. I didn't even know that. So I think one of the things it would be like to just shift that concept about having more of a humanity focus. So the concept of what a billionaire is, it's someone that wants to impact 1 billion people's lives. And don't get me wrong, if someone becomes a billionaire in money terms from impacting 1 billion people's lives, that's fantastic. If someone spends, let's say, $1 billion creating all the vaccines or supporting all the research, where as we can be treated very quickly with another pandemic, then and they sell those vaccines and become a billionaire. But at least the positive side is that they have a positive impact on 1 billion people's lives, or even more than that. Then that's fine. That's fine. That's fantastic, actually. So I think just moving that narrative away into like more of an egalitarian. I know it sounds very idealistic, but I always believe that in life you should at least try, rather than say, "Oh, that sounds too pie in the sky." Just just start that journey. You never know who might also resonate with what you're saying. I'd also want to join you on that journey as well. And then the most important thing is the journey. It's not the end game. It's just that journey of trying to pull people together in some kind of direction.
There's a silence, and that means only one thing. I as a professor, that's a profession that we engage in because of that love of sharing our knowledge. We are researchers, but we're also professors to share it with the
Yeah.
future generation, what we know, what we aspire to, what we are researching. And it's few hundreds of those a year times the number of years we've been doing this. When I was silent, I was trying to calculate how I'm going to get to that billion people that I would be positively impacting. And um, I was trying to do it without a calculator. And I got a little bit overwhelmed, and that's the silence when you finish about the positive impact with humanity focus. So I still have long ways to go, but that's an aspiration. Every year I go
Yeah.
just 1 year, one semester at a time. There is no, people ask me and ask other professors, would you get out of it? You're not getting extra money. You're not getting that $1 billion. Don't get me wrong. I will not turn down that $1 billion. Anytime you all out there, I'll take it in a heartbeat with the goal of embettering humanity, embettering focus. My focus is on knowledge in my journey. It's
Yeah.
because not to my understanding, knowledge will support all those key aspects in life if used properly
Yeah.
to help humanity, positive impact, save lives, and better a lot of things around us. The I've heard you during your keynote speech, as well as your postings about the 100 Ideas Cafe, which you mentioned about the startups. We also know that you love coffee, I guess. I like mine
Yes.
decaf. I like mine decaf. Uh, so yeah, in my teaching as well, whenever I'm a professor, they're like, I start serious, here's machine learning, modeling, and then I'll switch it to something hilarious. And they're like, can we do that? And I'm like,
Yeah,
yeah, absolutely. A knowledge and education and science should have some humor and some fun into it.
definitely.
Um,
Yeah,
and whenever I hear you, I get inspired to continue that route. Is there
thank you.
something about that coffee ritual that connects to your approach to leadership and creativity? I'm more emphasizing, you mentioned those 22 startups and how much they're impacting from, eye doctors um, to other ideas and possibilities. Can you
Yeah.
further expand on on that part and how it connects to your leadership and creativity, please?
Yeah, so I mean, actually, making coffee is actually very scientific. So there's a lot of measurement in it. So, for example, if I give you a basic thing, so usually the idea is 15 grams of freshly ground coffee is you should roughly be 200 milliliters of hot water, but the water should be roughly 94 to 95 degrees. That's that's if you're
Easy.
making what we call a pour over. But I always maybe that's the creative aspect of me. So when I was growing up, I really loved food actually. I love cakes and stuff like that. And I saw getting into coffee as a form of expressing myself creatively. So I used to love drawing, I loved art. I wanted to be actually a fashion designer at one point in my life. And the creative aspect I think is very, very important. Because it's something that kind of keeps that fire growing within yourself. So even every morning, I mean, I make coffee at least twice a day, different ways. In the morning, it's like a espresso or cappuccino style, and in the afternoon, it's a pour over. Um, but it's just that, the idea is that if you watch me, maybe you think I'm doing it very easily, but everything's been measured, everything's been taken care of because I'm trying to get the maximum taste, and what I want to actually appreciate this, this God-given product that's been given to us. So I think the first thing about it is just taking care. There's something, in Japanese philosophy about called ikigai. Some parts of ikigai require there's something called taking things slowly and just enjoying that moment in your life, at least whether it's in Japanese are famous for things like the Japanese tea ceremony. So they spend a lot of time, a lot of detail. Even in sushi, the amount of time they spend in making sushi, people don't probably really appreciate it. But just there should be some part of your day where you just slow down, you really enjoy doing something that you want to do. Now, how does that affect leadership? So at one point, I actually did have a cafe in Cape Town for about 3 years, and
Fantastic.
I've written a course called How to Develop an Entrepreneurship Mindset. When I started writing that course out, I realized the first chapter is actually on linking whatever you're going to do in life, whether it's a business or a job, with your purpose. Because once you do that, then at least no matter there's going to be good days, there's going to be bad days. But if you're focused on your purpose, you're not the candle still basically burns, right? But if it's not focused on your purpose, then you can easily get demotivated. But then also when I started writing the chapter two, I realized that leadership, whether you like it or not, whether it's your career or creating a business, you have to be a leader. If you're creating a business, want to understand why did you do this business, and those are leadership skills. You have to say, I'm doing this because I saw, um, I don't know, a gap in the market. I want to help people get this, and I want to provide this for them. Even some of the biggest companies in the world, it's all very basic stuff like social media is basically connecting. It's just a human thing. Human beings want to feel connected to people. They didn't reinvent anything, right? Even if it's the car industry, it's about traveling. You're traveling from somewhere to get to somewhere. You're not traveling into a desert. Most people don't do that anyway. You're traveling to see somebody or get to work to meet other people. Um, car industry, laptops or phones, they're designed for connecting with people. So human connection is very, very important. So I digress a little bit, but creativity I think is really, really important in terms of linking with leadership. And as you said, there should be some kind of enjoyment and joy in whatever you're doing. Because when you have that, and when that's manifesting something that you're passionate about, it actually becomes quite infectious. People see that joy. And you know, Simon Sinek has a quote that I actually use in my course. It says, people, let me get this correct. People don't buy what you do. They buy why you did it, something along those lines. So basically, why did you do something? So how you connect with people, not because you're saying, "Oh, here's a product." They want to know, why did you do this, and that connection gets stronger. That human connection gets stronger. So I think going back to that concept of being creative, enjoying what you're doing, because creativity, as it's it's done a lot to I think it's ascribed a lot to um Einstein. um Creativity is intelligence having fun. um he's I'm not sure if it's actually him. Someone said it's actually not him that said that, but it's usually ascribed to him. So it's the concept of having fun, enjoying what you do, and I really believe in that concept. I have another um concept called serious fun. um it's my concept of how life should be. So serious basically means, and it's serious, full stop, fun. The idea is you should seriously enjoy what you're doing in life, because life is not supposed to be based on just being serious all the time. There should be some kind of fun, because that's part of us. Humans have that concept of happiness and joy. Of course, we have sadness as well, anger and guilt, but also joy and fun is also part of us. And that's why people get attracted to us, whether it's in relationships. No one runs towards somebody that's angry and being abusive. They tend to run towards someone that's laughing or has a very inviting persona. So just to share that.
This is fantastic. This resonates so much with um, and I'm going to humbly say how I run my research or my teaching or my consulting. And a lot of my conversation, especially with students, I call it humus serious class. And this is where you said serious and fun. Um,
Yeah.
and I was doing a consultant pitch, and that was the same thing. I think I shared why I am doing this versus, okay, this is how I'm going to make money, or this is what you're going to get. And it just reinforced why I am going the route or why I'm behaving in that particular way. I know we're almost out of time, but I'm going to share a little bit about the coffee deal that I have with my undergrad and graduate students that sometimes get me in trouble, but I do it anyways because it's fun to me. It's joyful, but it empowers future leaders and it keeps them connected. So the coffee deal is when the moment I meet them, we have a fist bump and they'll look at me like, why are we doing this? Like we're shaking on, you probably seen one of my posts, we're shaking on once you graduate and make six-figure income, we're talking about 21-year-old, you're going to come back and invite me for a cup of coffee. And they're like, yeah, Dr. Parks, we're going to do that. And, you see that it's not going to happen. Then I said, okay, we're going to make a pact. I'm going to work as hard as possible, which I do anyways, to make you the most equipped, the most ready to get that job and hit the ground running. And I'm going to focus on the practical aspect on how they tie to theory, whether it's machine learning, visualization, data mining, and the applied part of it, not just the theory. And I do that. I push them. I really do. And sometimes they're very uncomfortable. Of course, I draw a line. I'm like, if you're uncomfortable, just let me know. But intellectually, I keep pushing them. The more they reach a milestone, I keep doing that. And sometimes in the US here, students, they have to write an evaluation of their professors at the end of the semester. Some of them are horrible. However, those students, which I don't know who they are, after what I can guess few, after they graduate and they hit the six-figure income within 2 years, and some of them less, they come back and invite me for coffee. They remember that deal from 4 years ago. Some of
Great.
them apologize for those harsh evaluations. This is the funny part, which I really don't care about right now. And
Mm.
leadership is watching right now. I may get in trouble, but I really don't care because I look at that impact down the road. That they remember I was pushing them, and now they're shining. They're
Yeah.
moving toward their goals. They're successful because I pushed them to a better them. So I love this coffee deal. I love your coffees. It's not nowhere near the 100 coffee idea or cafe idea, but to me, that's my minimal contribution to the future leadership. Again,
That's
this
great.
show is about you, but you mentioned there is this whole thing about coffee. I'm originally from Morocco and I spent my
Yeah.
Fulbright in Morocco. In Morocco, the whole deal is about tea. It's about
Yes.
mint tea. It's an
Yes.
entire ceremony. I remember from my childhood, you're talking about an hour or two. And from preparing to getting the right ingredients to the conversation around it, it's so, I don't know, allows you to slow down,
Yeah.
engage. And during my Fulbright, those 6 months Fulbright, I was those times were the most productive times of my entire life. And the
Wow.
reason being, I was taking every weekend off because the environment would not allow me to work.
Yeah.
I You know that between 12 and 2, you had to have lunch either with
Yeah.
your family or friends. After 6, anybody approached for data or for analysis, they said, no, this is family time, this is friends time, and we can forget it. So
Yeah.
the environment, the leadership environment sometimes, and you talk so much about leadership, is creating that environment that allows you to flourish. I was taking
Yeah.
time to um, to refresh my mind, to empower my body, but at the same time, that was the most productive time of my work and
Yeah.
my research. So this is not about me, but you make, I guess you make the people that interview you talk a lot more.
No,
That's an
no.
ability that you have. Um,
No, no, it's good to hear your stories as well.
So, any concluding insights or remarks from a Nobel Peace Prize laureate to the rest of us, to the rest of the world?
Um, I think one thing in some even related to that is I know it might sound a little bit mushy, but I think, you know, just trying to engage more with yourself. The world is moving so fast, there's so many distractions. And I think people, if they just give themselves 10 to 15 minutes a day just to relax and reflect, no social media, no phone, just sit down 10 minutes, silence, and then just let your mind wander about what really matters to you and how you can contribute, not just to yourself, what you want to do, but also we don't exist in a vacuum. There's 8 billion people of us on this planet, right? And I think if you're just more in touch with yourself, and you have more self-awareness, I think you will thrive, and also people around you will also thrive. So maybe just slow down, think more about yourself, and think about how you can have an impact on humanity.
Thank you so much, Lameen. I appreciate all your insights, your valuable input, and you're welcome to come back anytime. Let's give it a year and or even less than that. Thank you again so much for your time.
My pleasure, Rashida.